It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. What to do when a dog breaks a tooth. In dogs, the upper fourth premolars, the large upper cheek teeth at the back, and the canines, fangs, are the teeth that break most frequently. Chewing on hard toys like nylon bones, antlers, or even ice can break premolars. Fractured teeth in dogs should not be taken lightly. When enamel chips, dentin is exposed, making the tooth more sensitive to heat, cold, and pressure. The problem is more serious when it is the pulp that is exposed. The pulp of a tooth is made up of tissues that include the nerves and blood vessels that supply the tooth. When exposed to the immediate environment of the mouth, the pulp can easily become infected. Bacteria from the mouth can enter the pulp cavity. As bacteria invade the root canal, they have found a hiding place where they go unnoticed by the body's immune system. Sometimes the bacteria in the root canal cannot be eliminated by the immune system or even with a round of antibiotics. Affected dogs suffer from toothache when chewing. The bacterial pathogens responsible for dental infection can enter the bloodstream and reach other parts of the body where they can also establish infection. Repairing a broken tooth, what are the options? When your dog has a broken tooth, you should make an appointment with your veterinarian as soon as possible. Before performing any dental procedures, your veterinarian will thoroughly examine your dog's mouth to determine which treatment options are best. When a dog is brought in for a broken tooth or other types of dental problems, the main goal is to save the tooth and its function as much as possible. There are 3 dental procedures that can be performed to repair a fractured tooth with exposed pulp. 1. Root canal therapy. After evaluating your pet, your veterinarian will decide if a root canal is the best option. This is a procedure that will preserve root function by removing the blood and nerve supply to the pulp cavity and replacing these tissues with an inert dental material. To seal the pulp chamber, a sealant is placed over the tooth to prevent bacteria from entering. Your dog will undergo general anesthesia to perform a root canal treatment. If the same tooth is at higher risk of breaking again, a crown may be necessary. Placing the crown will require another session under general anesthesia because it will be placed on the tooth about 3 to 4 weeks after the root canal. After the procedure, your dog will be able to go home and do his normal activities the next day. A year later, your veterinarian can schedule a follow-up to make sure the procedure was successful. The success rate of root canal therapy is very high, 90 to 95%. 2. Vital pulpotomy, vital octopus therapy. In puppies under 18 months of age, a vital pulpotomy is usually indicated instead of a root canal. Puppies' teeth are still developing and are not fully formed. A vital pulpotomy involves removing the part of the pulp that is infected and then inserting a sterile medicated dressing into the exposed pulp to promote healing. A dental composite is placed on top of the medicated dressing to serve as a protective barrier. Compared to a root canal procedure, the success rate of a pulpotomy is slightly lower, 75%. Teeth that have undergone a vital pulpotomy may require root canal treatment in the future when the dog is older. 3. Tooth extraction. If the fractured tooth has exposed pulp, extraction is almost always the last option. Fractured tooth extractions are usually performed if dental X-rays show signs that a root canal procedure may not be successful. This is especially when the root has broken or there is tooth resorption. With extraction, the entire tooth is removed. After tooth extraction, your pet will need to be placed on a soft food diet for at least 2 weeks to give the mouth and tissues time to heal. Dogs that have had a root canal or vital pulpotomy can resume eating kibble immediately after either of these procedures. Most veterinarians do not require your dog to return for follow-up dental X-rays, but you should not skip or continue to postpone your pet's annual dental visits to keep your pet's teeth and mouth healthy. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.